number. I'm going to be your nurse practitioner today.
Great.
I see your first name is Casey. Is that what you prefer to be called?
Yes, that's fine.
Okay, great. What we're going to do, I'm just going to go through and kind of ask you about your medical history, and then later we can do, I'm going to do like a full head to toe assessment and vital signs if that's okay.
Yeah, that's fine.
So we're just going to talk for a little bit first.
Sure, sounds
So what brings you in today?
I'm really just looking to get set up with a new primary care provider.
Okay.
And also I've been feeling a little under the weather lately. I think I might have some kind of a cold. It's been getting worse, so I thought maybe it'd be a good idea to come in.
Okay, so when did that start? When did your symptoms start?
Probably about 5 days ago.
Okay.
It started off not so bad, but like I said, it's been getting kind of worse through the days. So I think that that's probably about it.
Okay, where specifically are you feeling pain at all?
Not so much pain. I mean, I do have a headache occasionally, but it's usually in the morning. I feel a lot of pressure in my face and.
So your face is where? Okay.
Yeah.
Your sinuses at all? Your cheeks? Nose? Okay. So you said it's been going on for around 5 days. Is there anything that makes it worse or relieves it? Have you taken any medications?
Usually if I'm not super hydrated throughout the day, I can feel that it's getting worse. But I do think that taking like over-the-counter cold medicine is making it a little bit better.
Okay, so you've taken some medicine. What exactly have you taken?
I've been taking the Alka-Seltzer Severe Colds.
Okay. Okay. How often would you say you've been taking that?
Well, the box recommends that you take it every 4 hours. That's what I've been
So
doing.
you've been following directions. Great. So severity, would you categorize it as mild, moderate, severe? What would your, have you done, what pain level would you say, 0 to 10?
I mean, probably about a 3 the majority of the time, but when it's really bad, it's like a 5.
Okay, okay. How are you feeling right now?
Right now I feel okay.
Okay, good. So we're just going to take a minute and talk about medications, if you don't mind.
Sure.
So let's first talk about what prescription medications you're taking.
Right now I take 60 milligrams of duloxetine every night, and I also have a prescription for Xanax as needed.
Okay.
And then I do have the Implanon implant in my left arm for birth control.
Okay, and how long have you been taking all of those medications?
The Implanon implant's coming up on about 3 years.
Okay.
And for the duloxetine and the Xanax is probably about 6 months.
Okay, 6 months. So how often, you said Xanax is Karen, how often do you take it, would you say, on average?
I'd probably say about twice a month.
Okay.
Not very
twice
often.
a month. Okay. And do you feel like you have any side effects you'd like to mention with those medications? Do you feel like they make you feel better? Okay. So those are prescriptions that you've gotten from providers. What about, do you take anything over the counter that you just buy at Walgreens, say cold medication?
Well, the cold medication, yeah. Sometimes I'll take Tylenol or Advil if I have like any kind of pain.
Okay.
But that's about it.
Okay. Do you take any supplements, herbs, any maybe vitamins that you buy at the store, any workout supplements, anything like that?
Sometimes I take a pre-workout before I work out, and I get that from the regular GNC store.
Okay.
But other than that, sometimes I take a vitamin D because my last doctor told me I needed to increase that.
Okay. Okay. Just asking because sometimes if we're taking a lot of extra medications, they can sometimes interact with the prescribed medication. So we just kind of want to get a good background for that. So, speaking about medications, do you have any known allergies to any medications?
Not that I know of.
Not that you know of. Okay. What about food allergies?
Not that I know of.
Latex, tape, anything like that? Okay. Do you have any environmental allergies, like to anything, dust, pollen, mold, that kind of stuff?
Probably pollen, but since I've moved down south, it's not been as bad.
It's been a little better. I have the same experience, so. All right, now we're just going to talk about your past medical history.
Sure.
Any underlying medical conditions that you'd like me to know about?
Not that I know of, no.
Okay, any past histories of surgeries or hospitalizations?
When I was 10, I was hospitalized for osteomyelitis in my left heel.
Oh, wow.
I was treated for 2 weeks in the hospital, and I went home on IV antibiotics. I think it was either Vanco or penicillin through a PICC line.
Oh, wow. That sounds painful.
Yeah, it was
pretty
a lot.
serious. So they sent you home with a PICC line?
Yes, they did.
Wow. All right. Any, leftover residual pain or anything from that time?
No.
No follow-up that you needed?
Nope.
Okay. Otherwise, no hospitalizations? They didn't do surgery on you at any point?
Nope.
Okay. Any history of pregnancy?
Nope.
Or anything? No? So overall, how would you say your health is?
I'd say I'm pretty healthy.
Okay, do you regularly see dentist, any other kind of specialist? Do you get eye exams, any kind of that stuff?
I get eye exams pretty much once a year because I do wear glasses and contacts, but haven't been to the dentist in a long time because I'm afraid.
Okay. What are you afraid of specifically?
I just don't like them looking over me and putting their fingers in my mouth. It freaks me out.
I can understand. It can be anxiety inducing for some people, for sure. If we do recommend visiting the dentist just because dental health can lead to overall health. They can detect a lot of health issues there. So if you would like recommendations, I have some really good dentists who deal particularly with people who are anxious, some sedation dentistry. If you would like recommendations later, we can talk about it.
Sure.
Okay, awesome. What about immunizations?
I'm completely up to date.
Completely up to date. Have you had a flu vaccine this year?
Yes, I'm required one for my job.
Oh, okay. Do you know what month you got that?
I got it in October.
October. Okay, that is great. That was my next question. So next we're kind of just going to talk about your family history.
Sure.
So I'm just going to kind of ask you about your parents, any siblings you may have, grandparents. Are your parents alive and well?
Yes, both my parents are alive. I'm an only child. My mom has hypertension, but she's controlled with medication, and my dad has diabetes type 2.
Okay.
And he's pretty much off of his medication because he's been doing really well. So his doctor has been trying to get him off of things because his A1C is really good.
Oh, that's great. That's really good to hear.
Yeah.
What about, do you have siblings?
No, only child.
No, only child. Very nice. What about grandparents? Are they alive?
My mom's mother is still alive, and she does have hypertension, and I think she has some kind of a thyroid disorder, but I don't know which one it is.
Okay.
And her father passed away from lung cancer, and then my father's parents are both deceased. My father's father passed away from pancreatic cancer, and my father's mother passed away. She had diabetes type 2, and she passed away from Alzheimer's and dementia. And then my father's sister passed away from appendiceal cancer.
Okay, so some GI cancer. Okay, and some hypertension.
Yep.
Okay, well, I'm sorry to hear that.
Thank you.
Any other things you can think of that might be pertinent? No?
Nope.
Okay, next we're just going to talk about you, your social life. So how do you feel overall? What do you like to do for fun? What are your hobbies?
I like to craft a lot, and I like to help with event planning. So those are some things that I enjoy. I also used to be a dancer, so I like to try to involve myself in as much as I can with, like exercise, fitness.
Okay,
So I
great.
like to stay pretty active.
Great. That's also a great way to relieve stress.
Yes.
Sounds good. So where do you work? I know you said you had to get immunized for your job, but
Yeah, I am a registered nurse at Tampa General, so I work in the ICU.
Ooh,
So I like it there. It's good.
nice.
Yeah.
So are you BSN?
Yes, I have a BSN.
Okay.
Yeah.
What are your 5-year goals?
My 5-year goals. Well, I'm getting married in the fall.
Oh, congratulations.
So, thank you. So that's definitely in there, but I'll be graduating with my master's degree in nursing education in August.
Good for you.
And then hopefully just kind of get maybe a clinical job just for part-time while I still continue to work full-time at the hospital, just to kind of get my feet wet, but I'm looking forward to kind of enjoying some time off from wedding planning and school and full-time work.
Sounds good. You are a busy lady right now.
Yes.
All right. So you said that you're engaged. Do you live currently with your fiance?
Yes, I do.
Yes. Okay. Do you guys live in an apartment house?
We live in an apartment. We're moving into a condo.
Okay, exciting.
Mm-hmm.
And do you feel safe at home? Do
Yeah,
you
absolutely.
like where you live? Okay. So let's talk a little bit about nutrition, exercise, dietary, all that kind of stuff. So I know you said you like to dance and you like to stay active. How many times would you say that you exercise a week?
Probably about 3 to 4 times a week.
Okay, great. Any history of tobacco or alcohol use?
No, I've never smoked at all, but I do, I would consider myself a more social drinker than anything else.
Okay.
I won't actively like come home and have a glass of wine unless it's with dinner sometimes. But usually when we're out with friends, I'll have more to drink.
Okay.
Probably, it's not like a weekly thing either. Like I could go like a week or two without drinking, but
Okay. So on average, how many times a week would you say that you?
I mean, it probably averaged out to about 2.
Okay. Okay. That sounds good. So any recent travel? We're just kind of trying to see if you might have been exposed to any potentially hazardous bacteria, parasites, that sort of thing.
The last time that I traveled, I went to Aruba, but that was a year ago in April.
Oh, okay. Just for fun? Vacation?
Yeah, just for vacation.
Very nice. I have never been. I heard it is beautiful.
It is wonderful.
So any cultural practices, spiritual practices you'd like me to know about that feel like influence your health promotion?
Not really. I mean, I was raised Catholic, but I'm not actively practicing.
Okay.
I consider myself more spiritual than religious.
Okay. Okay. Great. Anything else you'd like to tell me? Or
No.
any other concerns?
No, everything's pretty
Okay. Great. So before I do your physical assessment, I'm just kind of going to go through and ask you questions about different systems in the body.
good. Sure.
I'm sure you're kind of familiar with this since you are a nurse, but so do you have any headaches? Have you ever had a history of headaches? Any like loss in vision? Anything like that?
No, nothing like that. Usually just if I have like any kind of sinus pressure, I get really bad headaches, or if I get really stressed out, I get a headache.
Okay.
That's about
But
it.
no history of migraines?
No.
Okay.
And I never lost like vision or anything.
Okay. Okay. Any dizziness, lightheadedness at all?
Sometimes in the morning when I wake up, I'll get a little bit lightheaded or dizzy.
Okay.
But that usually gets better the more hydrated I am.
Okay. Yes.
I've been trying to really increase my water intake.
Okay.
So,
I would say that is good.
yeah.
Okay. Your eyes. So you said no. Any recent changes?
Oh, it's still going. I thought it beeped. Okay. My bad. My beep.
No, I
My
did
beep.
too.
Okay, go.
Okay. Any recent changes in vision?
No,
Any
changes
blurry
in vision.
spots? Trouble with
Nope.
driving late at night?
Mm-mm.
No. Okay. Have you ever? You say you go to eye doctors, right? Do you wear contacts?
I wear contacts and glasses.
Contacts and glasses.
Yeah.
Okay. Did you ever have any injury to your eye, like a burn, splash, any foreign objects, anything like
No,
that?
when I was 5, I hit my head on the corner of a coffee table, but the injury was really more to my like eyebrow than anything
I
else.
see a little scar. Okay. Well, that's good. I'm glad it didn't permanently affect your eyes, though.
Yes.
Okay. So now we're just going to kind of talk about your sinuses. I know you said you had some pressure in your sinuses. What about your ears?
Sometimes my ears feel a little full and they kind of like hurt more on like the inside of them, but it's really only when like the pressure gets really bad.
Okay. Okay.
Not
But otherwise,
typically.
no typical pain in your ear. You've
Nope.
never injured your ear
Nope.
in any way. Okay. Any drainage out of your ears, nose? Are you having a lot of sinus drainage?
A little bit in the back of my throat when I wake up in the morning, but
Okay.
it usually clears up by midday.
Okay. Any history of nosebleeds?
No.
In the past few years? No. What about your mouth? Have you had any difficulty swallowing?
No.
Is your throat doesn't feel swollen?
Not really swollen. Sometimes it's a little scratchy, but that's all.
Okay. Okay. Any sores in your mouth you'd like me to take a look at?
Nope.
No, nothing like that. Okay. What about your neck, your armpits, your groins? You know, these are places we have some lymph nodes. Any swelling that you've noticed?
No, not really.
Okay. You feel like you can move your neck? No.
Yeah.
Good range of motion.
Mm-hmm.
Okay. What about your lungs? Do you have a history of asthma? Any chest pain at all?
When I was younger, I may have had exercise-induced asthma, but I stopped taking the inhaler a really long time ago. I think it probably cleared
Okay.
up.
So maybe some childhood asthma. Okay. So no chest pain recently, shortness of breath.
No, usually if I'm really anxious, I'll feel like I can't catch my breath right away, but It's usually only when I'm really anxious.
Anxious. Okay, and what do you do kind of to relieve your anxiety?
Usually I'll just try and take a couple deep breaths. I'll kind of like center myself a little bit more. And if that doesn't help me feel a little bit better, I have the prescription Xanax.
The Xanax. Okay, perfect. That sounds good. It sounds like you have ways to cope. So,
Yes.
Great. Have you had a cough recently?
Not really.
No. Okay, that is good. Any wheezing that you've noticed at all?
Nope.
Any difficulty sleeping?
No,
Have
I've
you
been fine.
Okay. Have you been told that you snore?
Yes.
At all?
My fiance
Your
told me that I
fiance?
snore, but
Okay.
I don't believe him.
Okay. Well, you're always right, right?
Yeah.
Okay, so not that you're aware of that you're,
Right.
having any sleep apnea, trouble
Correct.
breathing with your sleep. Okay. Ever feel short of breath after climbing stairs or walking quickly, anything like that? Okay. Have you ever been told that you have a heart murmur or have any heart conditions at any point in your life?
When I was younger, when I was hospitalized for the osteomyelitis, they told me that I might have had a sinus arrhythmia. So I've been to a cardiologist before, and
Okay.
they didn't notice anything. So
Okay, so you followed up, but maybe it could have been
Could have been nothing.
infection. Yeah, who knows? Okay. Any palpitations that you ever felt rapid heartbeat or anything like that?
No.
No? Okay. That is good. Any swelling of your legs, arms, extremities?
Nope.
No, even, at night,
Nothing like
even on
that.
your feet, nothing like that? Okay. Do you ever feel like your hands are cold, your feet are cold?
Sometimes I think my feet are a little colder than the rest of my body, but nothing crazy.
Okay. If you get cuts on your feet, do they heal pretty quickly? You don't notice a difference in anything like that?
No.
Okay. So I'm just going to kind of talk to you a little bit about your, stomach, any gastrointestinal disturbances. How are you as far as your appetite?
My appetite's pretty good. I would say that it's average.
Okay.
I don't ever really feel one way or another about it.
Okay. But no loss in appetite recently, no changes in eating patterns?
Nope.
What about any weight loss or gain recently?
No, everything's been pretty
No,
fine.
pretty stable. Any pain after eating?
Nope.
Any pain without eating?
No.
No. Any change in your bowel habits?
No.
Diarrhea, loose stools, any oddly colored stools? Okay. No nausea, vomiting?
Nope, nothing like that.
That is good. Okay. Do you feel like any muscle weakness in any of your extremities at all?
No.
No, okay. Do you have any concerns about your skin at this time?
No, I think everything's pretty okay.
Pretty okay. Okay. You've never seen a dermatologist or?
No,
sounds
I
like-
probably should though because I have a couple of moles that look dark, so
Okay.
I know that you should really follow up with that, but I just haven't yet.
Okay.
Been really busy.
Yeah. We can take a look at them. What we really start to worry about is if they're kind of changing in color, changing in size, getting bigger, asymmetric. So we can take a look and, if we see what we think, if it warrants further investigation.
Sure.
Any other concerns you'd like to tell me about at this time?
No, I think that pretty much covers it.
Okay, sounds good. So I think now we'll go ahead and do your vital signs and then I'll examine you. If that's okay.
Sounds good.
All right, thanks.
Great.